The treatment options for thyroid cancer always require some degree of surgery. Thyroid cancer begins in the thyroid, but commonly spreads to the lymph nodes. There are different types, but the most common type very commonly spreads to the lymph nodes. The treatment for that involves both removing the thyroid and removing the affected lymph nodes, if that is the case. The most common symptom for a thyroid nodule is the presence of a growth, or asymmetry in the neck. If they're large, you can see them. But also, depending on the size, they may compress on additional structures, such as the esophagus, which is the name of a swallowing tube in the neck. So having patients complaining with difficulty swallowing, it's something that's fairly common. Also, specifically in cases of malignancy, of cancer, if that nodule or cancer involves the nerves that control the vocal cords, you have hoarseness as well as one of the main symptoms. Patients that are diagnosed with thyroid nodules usually have to go through multiple visits and different procedures with different providers to get to a diagnosis. In our clinic, we have all of that combined into a single day visit where the biopsy, the ultrasound is done the same day, the biopsy is done the same day, the biopsy is interpreted on site by our pathologists that come to clinic and look at that. And if surgery is needed, we as head and neck surgeons get involved immediately. So it summarizes a treatment that usually goes for several weeks to literally 1.5 hours or so from beginning to end. And the visit ends with the clear path of action for that patient. There's nothing in the state like this. In fact, this is pretty rare in the US as a whole. It's a very unique setting.